are some of the latest statistics regarding the substance prescription drug misuse problem in America. These numbers, I'm not going to, go into every one in detail. I think they're all quite alarming, and as you all probably know, the problem has been, exacerbated by the pandemic, and now we have, stronger drugs on the market like fentanyl, so overdose deaths continue to rise. But a statistic on this slide that really stands out to me is the fact that 1,500 kids abuse prescription drugs every day. And this just tells me that we have a lot of work to do as far as education, and then turning that education into action, getting people to clean out their medicine cabinet and really make a behavior change and destigmatize even talking about how, our medications, and understanding that, we have an abundance of them, and they help us, they serve us when we need them, but when they're no longer serving us, we need to find ways to get rid of them or safely store them. And that could be as simple as having a conversation with, a parent who your child goes on a play date and just saying, do you lock your meds up, or do you have any in the home? I know kids start experimenting as early as 12 years of age, and just starting that conversation. And I think you'll find people are pretty receptive to that. But I want to commend you all for being here today with us and doing the work that you do to help combat this problem.
We're going to really dive into some significant strategies that can help you prevent prescription medicine misuse in your community. Want to give you just a little bit, expand over what I started saying earlier. Prevention Action Alliance, our mission is to lead healthy communities in the prevention of substance misuse and promotion of mental health wellness. And this collaboration with Deterra is really part of our Matthew D. Schoonover Educational Center initiative. And the Schoonover Center was started by Matthew's parents. Matthew, unfortunately, lost his life 10 years ago to an accidental overdose, and started, like many students in school, in his high school years, started misusing substances, and that unfortunately ended up with a substance use disorder that ended up with his death. And when we do our work here, we are really doing it on behalf of all the Matthews, the families that we know, that we see, our kids. We're really focused on helping to prevent the grief that comes from having somebody with a substance use disorder and somebody that is experiencing that. We want to help prevent that pain from happening. So that's a little bit about what our mission is. And if you have any questions or want to talk further, always feel free. Our contact information is going to be at the end of the webinar. Feel free to touch base with us or visit our website. Matthew's parents are on there in a video sharing their story. And it's really poignant to hear them talk about it. We work with them on a regular basis and appreciate their passion for helping other families not experience the heartache that they have. But for us, one of those things that we start out talking about is what Megan just shared. We have a large number of prescription medicines in the United States, and so many of those are in our medicine cabinets and are not being used right now. And so we want to equip people with the knowledge that they need to safely use them, safely store them, and then safely dispose them. We talk a lot about secure and dispose at Prevention Action Alliance. We'll hear more later, but we have worked with coalitions throughout the state who are doing this important work. And we've also worked with their regional collaboratives to help develop some of the public health campaigns that you'll see. And then we also had the opportunity to work on a statewide project a couple of years ago, where we helped get 60,000 Deterra pouches out into the state of Ohio so that community groups, from grassroots groups to larger, more substantial regional coalitions, could get those resources out in the community. And so we're thrilled to be able to share some of what we've learned from them with you. We would be remiss if we as preventionists did not give you a little bit of that prevention science, and most of this is going to be familiar to you if you are any type of person that is working in the substance use field or substance use prevention field. SAMHSA, Center for Substance Abuse Prevention, identifies 6 primary prevention strategies as effective ways to help prevent substance misuse. 2 of those are standalone strategies, and the other 4 are effective and used with collaboration with each other. So we have information dissemination, which is giving people information, raising awareness about what the problem is. Education is actually equipping people with skills so that they have new knowledge of what they can do in their own homes or in their own relationships, so they can help prevent developing a substance use disorder. Alternatives are exactly what it sounds like. And if you have been in substance use prevention for a long time, you'll remember in the early days, alternatives was what we considered to be one of those primary prevention activities. We were providing an alternative to a positive activity that would prevent people from having an opportunity to get start using substances. So think of an after-school program. It might not have a specific substance abuse prevention strategy, except it's preventing people from doing something else during that time, and that in itself is a good thing. The 4th strategy is problem ID and referral. So that is being able to identify if somebody is at risk, if they are starting to develop a substance use problem, and then referring them either to additional education or onto somebody to be assessed for a treatment if they need treatment. Community-based process is probably one of our favorite strategies in working with coalitions, because that's what work coalitions do, is networking, collaborating with community partners, talking with each other, coming up with community events that can help strengthen our communities. And then environmental strategies are really that very much about changing that macro level. How do we change our communities as a whole to support a community norm that is going to support healthy behaviors? You know, what does a community norm around positive prescription drug use look like in our community? Maybe for our community, that looks like we don't share our prescriptions with other people on the street. You know, if somebody injures themselves, falls off a ladder outside working on their bushes, the neighbor doesn't immediately offer a painkiller they have in their medicine cabinet. Maybe that's what we're looking for. Maybe we're looking to impact the community norm that as soon as we're done with the medicine, we dispose of it properly. And our community has lots of resources to do that. So that's what environmental strategies are. They also include policies. So you've seen a lot of those policies be enacted lately with having limits on prescription opiates after surgeries. That type of thing is going to help prevent access to an excessive amount of opioids. So altogether with these 6 strategies, education and environmental services, those strategies are the 2 standalone ones. And the other 4 sort of layer and help build stronger prevention efforts in our communities. So we take these strategies and then we really move over to coalition type work. And we look at CADCA's 7 strategies for community change. So this is on that macro level again, but CADCA is the Community Anti-Drug Coalitions of America. Many coalitions throughout the country are members of that. Prevention Action Alliance is a member. Our statewide prevention coalition associations, we encourage them to have membership there because they get access to ideas from all over the country. They get a lot of technical assistance and capacity building resources that are going to strengthen work in the communities. So you'll see some of these are sort of similar. Provide information, that's a community strategy. Enhancing skills has a lot of overlap with that education piece. Providing support. Providing support is really interesting because we look at what does a community need to reduce their risk factors or enhance their protective factors against prescription medicine misuse. So that could be alternative activities, that could be support groups, that could be parenting groups, that type of stuff. So providing support is really just sort of that extra underlying layer that we can give communities to help prevent substance misuse. And then we look at changing access and barriers. A lot of the work that we're doing today and that we're recommending today really focuses on that. How do we reduce access to substances where we can properly dispose of our medicine? That's a huge way to reduce access. We can properly lock up our medicine. That also reduces access. So we're looking at sort of layering all of these strategies together. And then we look at changing consequences. And as a community group, if you are looking at developing strategies for drug-free decade this year, changing consequences is an interesting one you can look at because you can think about, are there ways we can recognize groups that are doing a really good job? Are there pharmacies or pharmacists that are doing a good job educating our community and partnering with us as a coalition or as a community group to give out information on medicine safety? Are there other people that are doing a great job? Is there a school that's doing tremendous work around this issue? And are they reaching out to parents and distributing information and providing opportunities to talk with their students or parents about preventing prescription drug misuse? Recognizing those people during the month of October is just a really excellent way to highlight good that's going on in our community. And then we look at changing physical design. And again, a lot of this overlaps, but it really also does connect with that access and barriers. You know, how do we use lock boxes in our house? How do we integrate drug take-back days into our community and events into our community? Do we have lights around our prescription drug drop-offs in the community? Is there a place in our community that perhaps our community doesn't want to go into the police station and drop off their medicine? Is there another place where they can go and drop off their medicine, perhaps a hospital? Is there a place where we can go and pick up a Deterra pouch so that we can do it at home, because that's going to be easier for us and that's going to be more comfortable for us? So changing physical design really can encompass a lot of different strategies and methods as we just put them together to help modify that community change and make that community norm be a positive one around substance prescription, safe prescription use. And then we look at modifying and changing policies, and that's not really going to come into place today as we're talking about it, but know that the work that's been done around the nation to create prescription drug management practices where doctors can go and see if patients are doctor shopping. We look at how many days of opioids you can prescribe after surgery or for an injury. Those type of things all connect to the modifying and changing policies. They're really at a macro level that is not necessarily our focus for today, but that is something important that we just always want to keep in mind when we're looking at how are we going to make community change in this area. So when Megan and I started talking about how can we help strengthen communities and how can we support communities best around prescription medicine safety, we talked about why is October just almost this perfect month to start really focusing and honing in on safe medicine practices. And one reason is it's National Medicine Abuse Awareness Month. So we're going to be giving you some tools here, but CADCA also has a prevent medicine abuse toolkit that if you want to go out to their website, you can go and find that. It's excellent resources. It's also football and homecoming season. So if you tuned in before we started, Megan and I were talking about weather and about football season and football and homecoming season. If you are in that age group, or if you are in communities where football is a big deal, this is a really great opportunity to be tailgating, to partner with hair salons and barbershops, those type of places. So we'll talk a little bit more in the next slide about it, but football homecoming season is just an incredible opportunity where to raise awareness around this issue in a way that people will not necessarily be expecting. Then we go into all the fall festivals and Halloween celebrations and the opportunities that those bring. Red Ribbon Week is celebrated in many elementary schools specifically across the country. And that's just designed to raise awareness about drug abuse and encourage students not to misuse substances. And they have, again, they have their whole website, and you might want to take something from there, or you might want to use it and partner it with Drug Take Back Days to just, again, help raise awareness around the issue of needing to prevent substance misuse. The Drug Take Back Day is always, almost always, typically the last Saturday in October and the last Saturday in April. That is organized by the DEA, but your community may have it on a different day and may choose to have a Drug Take Back Day that works more in line with what your community seasons are. And some people have them in September, and that works for their community. The benefit of doing it in line with the DEA are two benefits, really. Everybody in the nation is sort of getting all this awareness happening at once. And so it's an easy way to sort of piggyback on that awareness that's going on throughout the country. But it's also nice because then the DEA picks up the tab for disposing of medicines. So if you're a local community and resources are scarce, it's a good way to partner and save some money for your local community. And then Megan brought up a really good point earlier, and I want to give her an opportunity to talk about holiday preparations.
I was just thinking about also why October is a great month, because that Take Back Day, that last Saturday in October, it's like that final push to really encourage people to clean out their medicine cabinet prior to holiday season, because we know that friends and family are gathering. And unfortunately, this might also mean there's an opportunity for diversion. We know kids are coming, or people are coming back from college, getting together with their friends. So the holidays can be a very joyous time, but also painful for some. And post-pandemic, I was thinking about this. There are probably going to be a lot of people who are grieving the loss of a loved one around that time. And if we reduce the access, then we could really help somebody in a moment of crisis, or when they're feeling down and mourning the loss of a loved one. So preparing for that time, which can be a wide range of emotions, I think will be great. So that's another reason why October, I think, is the perfect month to really push for an initiative like this.
I agree. And maybe so many of our coalitions are doing work and getting information out for the holidays with a disposal bag, with some flyers or booklets about safe medicine practices. Because so many of our coalitions are also doing work around mental health wellness. We talked about grief, and I think that's a perfect time because you're thinking about what resources can we give out. Just because you're at a take back event and you're giving out this information on safe medicine disposal doesn't mean you can't give out information on how to be mentally healthy during the holiday season. So it's really just one more opportunity to get people resources to just help them be well overall. And I love the way that we can partner that and pair all that information together.
Definitely.
When we're talking about looking at the fall and looking at creative strategies, we have a lot of ideas and strategies that we've seen work throughout the country on how to do take back events, how to do safe home disposal, how to get information out. But we're going to focus on just 3 general areas today that line up with this fall strategy. And those are schools and partnering with local retailers and then focusing on those fall events. As an aside, just a quick reminder that we have a Q&A at the end. We welcome either your ideas of things that have worked in your community or your questions about how to maybe tweak these ideas to work in your community, and use it as an opportunity to really share collaboratively with that. But when we look at schools, there are just a wealth of opportunities, and I know that so many of you know that and are already doing just a tremendous amount of work around this. But we have youth-led prevention groups that work in schools, so partnering with them on seeing what is an effective way that they want to reach their peers about this, right? Youth-led means that they come up with the solutions for us. So we've seen groups in Ohio create a wellness day and have all types of different workshops around mental health wellness and substance use prevention, and that's all led by their youth-led groups. Red Ribbon Week, we've already mentioned as a possibility, but parent communications, now that we have so many parent communications going out through, all calls at the school or emails that are going out to the entire school or going out through different platforms that the school uses to communicate with parents, partnering with your school administration to add a quick message about safe medicine usage, storage, and disposal is a great way to raise awareness this fall. We've seen some schools that have had like a whole week that focuses on substance misuse prevention and around the safe medicine usage. And some of the schools that we've seen then they've done education in the schools with the students. Then they layer onto that parent communication. And then they say, and at the football game this Friday, we're going to be tailgating outside. We're going to have a ton of resources and pick up a disposal bag so that you can go and implement disposing your meds at home. So they're just layering all these strategies together to help support the school community in being healthy. And I would be remiss as a new football mom to say the role of athletic trainers and coaches cannot be understated. They are really the center of our athletes' world at this point. So getting them on board, they're making sure they have access to safe disposal and safe medicine practices so that they can encourage students, and they're seeing students get frequently. And so, telling the students, this is, you need to make sure that you're using it according to directions. Parents, you need to make sure that it's locked up. As soon as they don't need it, they're not using it anymore. You can make sure that they are disposing it as soon as you're disposing it as soon as it is no longer medically necessary, so that we can protect our young brains and make sure that they do not develop a substance use disorder. And then again, a lot of those athletics, extracurriculars have opportunities to come in and have speakers from the outside. So that brings in an opportunity for coalition leaders, hospital leaders, any pharmacists, like all of those folks to come in and do just a quick presentation about safe medicine practices. And then as we're looking with local retailers, thinking about what does homecoming look like in your community. So what does homecoming, and then think about further down the line, right? In the spring, prom is the same idea, right? Let's partner with our barbershops. Let's partner with our hair salons to get that information out. Parents are going to be there for a long time waiting to ask their kids of getting their hair done, right? Let's provide some information in the waiting area so they can pick it up and just have one more way that they're getting that message across. Florists are also a great opportunity to find ways to distribute that information. And then a lot of the local retailers, depending on your community, are going to be doing some type of Halloween or fall festival A lot of places have, door to door, whether it's trick or treating or something else, trunk or treats in your community. If you're passing out information about substance misuse prevention, it's a great opportunity to get that out in the community. Obviously, you're probably going to want to pair that with something that's fun that will be well received, be it something that is a sugary sweet or something that is some other type of pencil sticker, that type of thing, to get those out into the community. And again, that goes right into our community events. Are we having trunk or treats? Are we having fall festivals? Do we have farmers markets? Often farmers markets will let you, as a nonprofit or coalition community group, set something up for free or reduced rate. Craft fairs, as we're heading into the holiday season, are also really great ways to get that information out into the community. And I think you probably are just going to want to think about what is it in our community that is special to us. Are we having a specific festival that is only in our community? Do we do something that's unusual for our community? Does our community celebrate different holidays than a lot of communities? And how can we partner and get that information out? Is there a way to partner with the faith community throughout all of these things? So I think those are some important creative fall strategies. Megan, are you seeing anything else through all the groups you're working with that you think fit well in there?
Yeah, I'll just mention one thing as we go back to schools and working with schools. I'm talking to administrators and school nurses all the time, and a common theme is that the school nurses have an abundance of medication at the end of the year or mid-year that they need to dispose of. And B, they are confiscating a lot of vape pens, and Deterra does deactivate vape fluid, nicotine and THC-based vape fluid. There are some differences there. I won't go into all the detail, but I wanted to let you all know that we'll send a one sheet after this presentation so you can look at what that entails as far as educating schools on the fact that if they do have confiscated vape pens, how they can deactivate that vape fluid and make sure that it's not available for diversion or misuse. In addition, I wanted to add that, piggyback on what Alice said, school sports, oftentimes there are injuries where adolescents are getting their first exposure to narcotics. So it couldn't be more fitting to have this conversation as this might be their first exposure to pharmaceuticals or narcotics. So, and also one last thing really quickly, the environmental message I've found really is effective when we're talking to our youth. The fact that we're not flushing the pills down the toilet or putting them down the drain and how they might be harming the environment, that tends to get them really excited about talking about medication and drug disposal, almost a little bit more so than, drugs are bad, don't take them, don't do them, but hey, clean out your medicine cabinet so that we're not negatively impacting the environment. And then all of the environmental messaging that goes around, the sustainable production of the Deterra pouch specifically. So we can get into that. I could probably do a whole nother presentation on that. So I'll just leave it there. But I did want to really mention and emphasize that the nicotine-based vape fluids can be deactivated in our pouch.
I love that. We were talking earlier today about that, and I didn't realize that Deterra did that. And I was so excited because I'm thinking of all of our school administrators who may not have the vape pens that they confiscate locked up, and if they do have them locked up, then what are they doing with them? It's not a typical something that would go in the dump box, prescription drug dump box. So I love that there's a way to get that taken care of. And I think it's an opportunity for coalitions to think about ways to make sure they offer that to school administrators and be able to get those safely disposed. That's just, I guess, an added bonus on top of prescription medicine safety for today, but I love it. We talked a lot about and promoted this event as really focusing on honing in on Drug Take Back Day. And so we want to make sure that you have the resources you need to do a Drug Take Back Day event in your community. You do need to partner with law enforcement. They have to register. And so there is the link to learn more about Take Back Day, QR code if that's easier for you. But like this picture here with Rise Up Ferndale in Arizona, there's just so many ways to partner and add on to traditional Take Back Day activities. So a traditional Take Back Day activity would be law enforcement with a big box, and people come in and give their medicines, and then they dump them, the law enforcement officers dump them in the box and then take them away and incinerate them later. But think about, how can we add all of these different community strategies, right? What information can we give out that has that public health message about safe medicine usage, storage, disposal? What resources can we give them to know where to dispose of their medicine in between those 6 months of drug take-back days? Is that we're giving them a Deterra pouch for themselves and their neighbor, maybe who cannot access it? Are we giving them those things and a list of dump boxes in their communities? Are we giving them maybe a QR code so that they can get a free pouch in the 6 months in between those times? Those are all ways that we can sort of layer on top of those. But I also wanted to challenge us to explore other places that we can hold drug take-back days. So a traditional place would be a police station, right? That makes it's really easy for the police to be there accepting substances. But not all of our communities are comfortable going to police station. Not all of our police stations are easily accessible. And so how can we bring that out sort of into the community? There's a lot of folks in Northeast Ohio that have them at grocery stores and pharmacies, so that as you're going in and doing your Saturday grocery shopping, you can, you're getting this publicity, the PSAs and the radio announcements the week of, and to bring in your unused meds. And it's super easy, right? We're reducing barriers to getting it done. And then they're able to pick up information. The grocery store pharmacy has this opportunity to sort of give back to the community by providing this opportunity. So it's really a great community effort there. We also look at some hospitals. Hospitals in Northeast Ohio and in Ohio General tend to be a really good spot for different take-back activities. And then a variety of places just have a drive-through option. And it may be, I don't know, a parking lot, a larger parking lot at an organization that is volunteering, a corporation is volunteering a parking lot. And so then the coalition partners with law enforcement to create a drug take-back day event there, or maybe a place that is no longer in business, but still have access to the parking lot and the community can go through there, or possibly your school or your faith community where you can go and do a drive-through and make it extremely convenient for people to dispose of their unused medicine. And then we also want to encourage you to access resources so that you can really do a lot of different things to raise awareness this week. And we'll be offering resources from our membership center later that you can use to help raise awareness around this. I realize that we're getting closer to the end of our presentation, so I'm sort of going to the next slide, but always happy to talk more offline about what ideas do you have in your community and brainstorming different things that are going to work. So again, this is in part what we just said. We are raising awareness through Drug Take-Back Day. That's why this strategy is important, because it draws awareness to this twice a year. Then we're going to equip people with information that we give them. We're going to provide them resources. Are we providing them a Deterra pouch? Are we providing them a lockbox? There are all types of physical resources we can provide them to help them safely use, store, and dispose of their medicine. And then all of those things sort of layered together to make the Drug Take Back Day event even more meaningful than just a simple drug take back event, which is great in and of itself. Megan, do you have anything that you wanted to share about the things that you're seeing in your community and around the nation?
Yeah, I'll mention one thing too, just regarding Drug Take Back Day as a whole. Sometimes they don't accept liquids, so having the pouch or container is one way to help with that issue. But also, I think really importantly, I saw this. I was at the Association of Wisconsin Counties conference and talking with their human services department. This is one example of what they're doing for their Drug Take Back Day. I'm sorry, I have the blurred screen. But this is just a harm reduction kit, stand up to opioid related overdoses. It's equipped with Narcan, a magnet, and I've seen communities do magnets with where the locations of the drop boxes are, their law enforcement, suicide prevention hotlines, treatment resources. I mean, really sky's the limit. So you can couple that with, you know, the education on proper medication disposal, take back day. I mean, it all goes hand in hand and works together. And I think especially with, you know, fentanyl on the streets, counterfeit, educating people about Narcan and having that available too is a really cool idea.
I agree, and a really good way to collaborate with other partners like your health department or treatment organization or harm reduction organization in your community. Every opportunity we have to get those resources out to people, I think we should take advantage of for sure.
Definitely.
So we wanted to offer you some resources for your community. We hope you came for some of the creative strategies that we shared, but I used to be in development for a local coalition, and I know that I was always looking for how could I stretch our money the most to get the most resources into my community. And so Prevention Action Alliance is thrilled to offer you one half of this sort of deal. We're offering a free annual membership to our digital member center. And so that has community engagement resources that you can print and co-brand so that you can print them locally, get them out at your Drug Take Back Day activities. So you will be able to get resources to your community. We have a social media toolkit. You can see our dog here, which is probably my favorite post because pets are always a really good way to connect with people. But it has really a diverse group of individuals that are focused on and seen during this campaign to appeal to different age groups, different ethnicities and races, different genders, different family makeups, so that we can really equip people with information that they need so that they can see it and hear the message over and over and over, that we know how to use our medicines. We keep them secure, we store them securely, and we also dispose of them properly. And then you are always welcome to go to our store that's on our website, and we have printed materials if you want to purchase them, available for purchasing. That is always something, if you want something physical to hand out and you don't have the opportunity maybe to print them in your local community, that is another resource that you can have. But at the end, you'll get a coupon code for this. You have information on how to set up your own press conference, how to create a public service announcement, how to have a month-long of social media posts so that you can communicate this with your community. So if you are looking for something to communicate prescription medicine safety, we hope you'll find value in this, and it will be something that you can use in your own community. And then Megan is going to share about this health economics calculator that just has me super excited because it's a resource that most local coalitions will be able to benefit from.
Yeah, so I think, you know, I've talked to a lot of organizations there, and they're always looking for ways to quantify, you know, the impact of their campaign, especially if you're applying for grants, you're looking for evidence-based prevention. And prevention is quite honestly really hard to quantify in a lot of ways and to get that data, but we do look to the data. And we had this study done, which is based off of 12 published clinical studies and the impact of substance use disorder on communities. And this is a free resource, you guys, that you can access on our website 24/7, and it's super easy to use. I'd be happy to walk you through it as well, one-on-one. But essentially, you can calculate the impact of implementing an evidence-based prevention solution like Deterra, whether it's you're an employer and you want to reach your employees, your community, or if you're a PBM and you're looking to incorporate this in your health plan. But let's focus on community because that's what Drug Take Back Day is all about. So you just would plug in the number of residents that you're looking to reach. It calculates per household because obviously we're not going to hand one to anybody 10 years or younger, you know what I mean? So I just plugged in, population of 70,000. It's going to tell you what the cost of implementing something like Deterra is going to be. And then it's going to tell you your net savings in productivity, healthcare claims, and criminal justice costs. And you can take that information, share it with whomever you'd like. And it just helps to put into perspective that handing these out, people are 10 times more likely to use them, but they also have a positive impact in reducing some of those major costs in our community. So please reach out to me if you have any questions and you'd like to learn more about this resource that we have. I'm happy to go through it one-on-one.
And we have a webinar coming up in January. We'll have the link at the end of this webinar for January 11th at 11 a.m. talking about sustainability and how to sustain your prescription medicine and your misuse prevention efforts. And we can go more into detail about that calculator then, because I think it can probably be one all of its own. But where to find money to initially purchase Deterra, at that cost, so you're going to save money for your community. It helps make the case in your grant proposals. So we love that. Thank you, Megan.
Of course. And so these are just a few additional resources that we have available to all of you. So it is our grant guide, our funding directory. We try to keep these up to date based on what's happening, with SAMHSA grants, DOJ grants. And this is something in our next webinar for you guys we want to elaborate more on. But in the meantime, if you want to go take a look and take advantage of some of those, please feel free to download those from our website. Also, I wanted to mention that we have two awesome people on our team. Rob Reynolds, he's our director of advocacy. He's a retired police chief, and he's been really instrumental in working with law enforcement coalitions, drug task forces, helping them to strategize, connect them with other organizations. And he's a resource for all of you and helps me a lot. I learn every day from Rob. We also, a new member of our team is Ian Goldstein. He's our government affairs director. He recently joined us from NACO, National Association of Counties, and he has been wonderful and extremely knowledgeable on the government side. So we're talking policy change, legislation, things like that. So if you need any advice or just want to talk through some ideas in that regard, Ian is the guy for that, and I'd be happy to put you guys in contact with those two resources. And lastly, I'll mention really quickly, if you have Deterra on hand or you're looking to implement it in your Take Back Day, we offer a complimentary easel. It says take two, one for later and one for your neighbor. We know that not one solution fits everybody. We know that maybe there's transportation issues, people can't get to the Take Back Day, or somebody might have, their neighbor might be aging and they have a lot of medications on hand that aren't serving them anymore and they need need to dispose of those. So the pouches are kind of just a way to reach a larger audience. And that's why we created that easel for you. So if you don't already have one, but you have pouches, reach out to me. Happy to send you one or a few. Just let me know.
So then these are the coupon codes for you to get the deals that we talked about. So if you go to the Prevention Action Alliance website and look at the PAA store on there, you go to the prescription drugs and member center, and you add that to your cart at the checkout and put in the code DTV or Kickback Day 22. And you will get a free annual membership with access to all of those digital resources. And this is the coupon code PAA5 for 5% off of your Deterra wholesale case quantities. I think they need to contact you with that, right, Megan?
They do, yeah. We are working on, and probably for our next round of webinars, we will have this available. But for now, you will need to contact me. And by having that available, I mean being able to just go on our website, order case quantities, and put in a quote of the coupon code. But I'll have to do that manually right now. So please reach out.
Excellent. Well, actually, I'm hoping that maybe you can help us if there's any Q&A that we have that we can answer in the next 10 minutes. This is our contact information, but in the next couple of days after this webinar, we'll be sending you the presentation that will have our contact information in it. So if you don't get it now, we'll be able to have access to it later.
Yes, so there are two questions in the Q&A, one of which I believe you just answered. Merle had the question of how do we take advantage of the free 1-year membership? And so with that, they would have to reach out to Megan, correct, through the email that's on the screen?
The 1-year membership is through PAA, so they can reach out to me and I can walk them through it. We can set up a time to walk through it if that's easier. We can also make sure we have the links directly to that on the store and the email that we send out afterwards.
Okay, wonderful. And then Victoria has a question. How can we connect with the DEA to get our non-traditional sites promoted?
That's a good question. And since I'm not with the DEA, I do not know. When we were doing drug take back days at a local level, always started at the DEA Take Back Day website. And then sometimes we had to sort of go through some of those links and sort of do a little bit of investigating to find out who our local DEA contact was. And they change frequently, so it wasn't always the same person. But if you have a non-traditional site, and I don't know if that means it's with a grocery store or a community place, my understanding is you still have to partner with law enforcement. So you may even want to start with your local law enforcement agency. I'm not sure if that answers your question or not, Victoria, or if Megan has additional information.
I would say, I think first and foremost is probably to start with contacting your local law enforcement and see if they have plans. And then also if they work with somebody or they have a relationship with a DEA support in your community. And then of course their website I think is pretty easy to navigate and very helpful in registering your site and things like that. So I would just echo what Alice said basically.
Alicia asked, what was the name of the organization that had the hard reduction kits made?
So it was the Wisconsin Department of Health Services, which is just one, but I can get you some more resources. I know of several other organizations who are doing something similar with their harm reduction kits, and we've even talked to some that are now opening a vending machine for harm reduction, which I thought was a really cool idea. It might just be the latest and greatest and being able to serve your community with all their harm reduction. So
Okay. And we have those in Ohio too. I know we just got ours from like the Franklin County Mental Health and Recovery Board, but we can try to find some links to include in the email that goes out to you afterwards, because everybody should have access to the law. So
yeah, and I have I can provide a contact information to the person with Wisconsin Health and Human Services, if that's helpful too.
And we have one more question. Darian asked, how do we go about the initial contact to law enforcement to coordinate Take Back Day, especially if it is our first time conducting a Take Back Day?
I'm not sure if you have a law enforcement person sitting on your coalition. It sounds like possibly you may not. So I would start with who you have on your coalition and sort of do that networking tree out. Do you have a school on your coalition as a school resource officer? Typically, those are members of the local law enforcement community, and they may be a way to find your way in there. If you have somebody on the government, so if you have a mayor or a chief of staff that is on your coalition, they should be able to connect you with them. But if you don't have any of those folks that you're working with already, then I would go to your community relations officer at the police department. That would be the first place I would start if any of my networking tries didn't really pan out. Megan, do you have other ways that you found to be effective for you people to connect with law enforcement?
If you do have a drug task force in your community, typically law enforcement does sit on the drug task force. And so that would just be another way in to start conversations. And if they're not already implementing the Take Back Day, I'm sure they would be very open and receptive to it.
An attendee actually assisted in answering this question. Alicia said, we have been doing drug take back for about 15 years. Contact local law enforcement and ask for the DEA contact. We have several organizations doing non-traditional locations. As long as you have a member of law enforcement on site at all times and you register through the DEA, you will be good to go.
Awesome. Thank you, Alicia.
Thank you so much, Alicia.
Appreciate it. Well, I'm going to go to our final slide. These will be in our presentation notes that you get. But if you wanted to dig further into any of our statistics or information that we shared about prevention science, these are the links and the references that we use. So we will give you back a few more minutes, I think, on your
I just wanted to say thank you everyone for joining us today. Hopefully this is the first of many series we'll do with different topics. I hope you receive some value from this conversation, and I can't thank Alice and her team at Prevention Action Alliance enough for joining us and collaborating on this effort. This is our very first webinar, and looking forward to working with them some more in the future.
Thank you so much, Megan. Thank you all for coming. This has been a delightful way to spend a Wednesday morning. I think we're going to stay on if anybody wants to stay on and ask more questions. But if not, have a great rest of your Wednesday. We are looking forward to continuing to bring you resources in the future. So have a great day. Thank you.
Thanks, everyone. Have a good one.
Actually, I forgot to say that we put the evaluation link and the webinar registration in the chat.
Yes, it is in there.
Okay.